Hey everyone, welcome to our program, Challenges for Women and Families During COVID. Thank you for joining us today, and a special thank you to our knowledgeable speakers who have generously given their time to inform and educate us on what is happening behind the closed doors during COVID. Please type your questions into the chat room. We will address as many as we have time for at the conclusion of the program. So we're so lucky to have three knowledgeable and experienced speakers with us today who each have impressive resumes, but due to time constraints, I'm going to provide a brief introduction for each speaker now. So our first speaker will be Vinnie DeMarco, President of the Maryland Citizens Health Initiative, who will present information regarding equity in healthcare. As president of the Maryland Citizens Health Initiative, Mr. DeMarco handles a coalition of over 1,000 organizations seeking to ensure quality and affordable health care for all Marylanders. Mr. DeMarco has held chair positions for both the Board of Marylanders to Prevent Gun Violence and the Maryland Clean Energy Jobs Initiative. Currently, he is an adjunct assistant professor at the Johns Hopkins Bloomberg School of Public Health. Mr. DeMarco's work is the subject of a book by national advocacy leader Michael Perchuk entitled The DeMarco Factor: Transforming Public Will into Political Power. Our second speaker will be Laura Wheel-Dryer, Executive Director of the Maryland Family Network, who will address COVID effects on the family unit. Ms. Wheel-Dryer has previously served as the Chief Officer for Everyone Graduates Center at the Johns Hopkins University School of Education. She has also worked nationally on a variety of educational reform projects with school systems, state departments of education, and nonprofit organization, and as a senior consultant for a public sector management consulting firm. Ms. Wheel-Dryer worked as a senior fellow with the Johns Hopkins Institute for Education Policy and as a member of the Maryland State Board of Education. And our final presenter is Lauren Shavitz, the Executive Director of HANA, who will discuss abuse issues during COVID. Ms. Shavitz found her passion for helping abuse victims during her freshman year at Hamilton College in Clinton, New York, when she completed an extensive training session on how to be a rape crisis hotline volunteer. She graduated from the University of Maryland with a dual degree in law and social work, and then worked at the House of Ruth, Maryland's Marjorie Cook Domestic Violence Legal Clinic. Lauren implemented domestic violence training sessions for medical personnel at Sinai Hospital's Family Violence Program and worked as a forensic interviewer at the Baltimore Child Abuse Center. I don't know how you guys have time for anything else. This is just incredible. So with all that being said, Mr. DeMarco, would you please start our program with equity in healthcare? Thank you.
Well, thank you, Cece, very much for this opportunity. Monica, thank you very, very much. I want to say that for decades, I've been a big fan of your organization, and in particular, Joanne Orlinsky, who is a true hero in our state on many of the work she and all of you do. And we've worked together on issues of reducing gun violence and making our climate cleaner and better for all of us, and in particular on healthcare. And our organization, the Maryland Healthcare for All Coalition, with your support, has made tremendous progress over the last 20 years of our existence, even before the Affordable Care Act, when we increased tobacco and alcohol taxes, which reduced teen smoking and underage drinking, and expanded healthcare with your strong support. And of course, the Affordable Care Act has been a game changer. Under the Affordable Care Act, because Maryland fully implemented, we expanded healthcare to over 400,000 people and reduced our uninsured rate from 13% to 6%, which is great. Of course, as we all know, the last 4 years before January 20th of this year, the law has been under a threat, a dire threat from Donald Trump and the Republican leadership in Congress. And we in Maryland have stood up to that threat. And at our request, the legislature created a Health Insurance Coverage Protection Commission, on which I served. And that commission recommended measures to the legislature, which has reduced premiums under the Affordable Care Act for Marylanders and really made healthcare more affordable. And two great new laws in 2019. One is the first in the nation Prescription Drug Affordability Board to make prescription drugs more affordable, and the first in the nation easy enrollment law that for the first time in Maryland at tax time, people who aren't enrolled in healthcare but eligible for free or low-cost healthcare can get enrolled. And thousands of Marylanders, including children and families, have gotten enrolled that way. So this has been tremendous progress. Well, where do we go from here? First of all, we are all thrilled about the commitment of President Joe Biden, Vice President Kamala Harris, Majority Leader Chuck Schumer, and House Speaker from Baltimore, Nancy Pelosi, and what they've done to improve the Affordable Care Act and the recent American Rescue Plan, and what we're also going to do more at the federal level to make the Affordable Care Act more affordable for people, which is great. So we're going to continue to love that success at the federal level. And I'm working with Senator Chris Van Hollen to put in measures at the federal level to do an easy enrollment kind of law at the national level to get people enrolled at tax time, and something on prescription drug affordability. But we in Maryland this session are working on what I'm calling a trifecta of healthcare progress. Well, first of all, Joanne mentioned veto overrides. The legislature did override also a veto Governor Hogan made of a bill to provide funding for the Prescription Drug Affordability Board. So now that agency is in full steam ahead mode, which is great. But we are working on three measures, and you all said behind the scenes. Behind the scenes is right. I'm an old man, and I've been going to Annapolis in the flesh since 1983. And this is the first year I've not been in Annapolis, and it is so unusual to do everything, hearings, meetings, and everything by Zoom and phone calls and texts and emails, but it's happening. And we are going to enact this year three really terrific measures. One of them builds on the easy enrollment program, which, as I said, will find people at tax time who are uninsured and connects them to the health exchange. We are going to pass a law, and Delegate Lori Charkoudian from Prince George's County and Senator Jim Rosapep from Prince George's and Anne Arundel County are the lead sponsors. This measure would connect people when they file for unemployment insurance. When they lose their jobs, that's when we're going to connect them to the health exchange. Many thousands of people lose their health insurance when they lose their jobs and don't know what to do, and are so desperate just to put food on their table, they don't know that they have this option of low cost or free healthcare. So with this bill, which I'm confident is going to pass, they will be connected when they file for unemployment insurance to the health exchange to get low cost or free healthcare that's available to them. And this is a House Bill 1002, which is the reason I'm going to have to get off the Zoom right after I speak, and I'll try to come back for questions, but I'm not sure because that bill is on the floor of the House this morning, and it's Senate Bill 893, which is before the Senate Finance this afternoon. Very important measure. And I didn't mention earlier that there are a dozen states trying to replicate our success in easy enrollment and prescription drug affordability. And many of those states are looking at what we're doing also with the unemployment insurance connection to replicate that, hopefully after we pass it. We will find many, many people who are eligible for free or low-cost healthcare and don't know about it and get them enrolled, which, by the way, is good for all of us, because the more people are enrolled in healthcare, the less pressure there is from uncompensated hospital care, et cetera, on premiums going up for all of us. So we all benefit. So that's number one of the healthcare trifecta, is unemployment insurance connection to the health exchange. Second is more subsidies from the state for young low-income adults who are eligible for the Affordable Care Act subsidies, but it's not enough. Now, there are going to be more subsidies under the Affordable Care Act through the American Rescue Plan, as we just mentioned. But in addition, under this measure, which is sponsored by Delegate Ken Kerr from Frederick County and Senator Brian Feldman from Montgomery County, House Bill 780 and Senate Bill 729, this measure would provide $20 million for additional subsidies for lower income young adults who are unable to afford healthcare, even with the subsidies they have now, and get them insured. Now, many of these are the young invincible types who feel like nothing can hurt them, but when they go to the hospital, they run up huge bills. That hurts all of us through uncompensated care and higher premiums. So let's get them insured. Now, Massachusetts has had additional state subsidies for people under the in Massachusetts for many years, and their uninsured rate is 3%. So we're at 6%, but we've got a model of Massachusetts to go to at least down to 3% through a program of additional subsidies. And that bill is moving through the House and Senate. Also, we're hopeful that that will pass. Second part of our trifecta. The third part is something I'm very, very excited about, called the Health Equity Resource Communities. Health Equity Resource Communities. Senate Bill 172, sponsored by Senator Antonio Hayes of Baltimore City, and House Bill 463, sponsored by Delegate Eric Barron and Jazz Lewis of Prince George's County. This is modeled on a highly successful program that was enacted under the O'Malley Brown administration in 2012 called the Health Enterprise Zones, which very systematically directed state resources into communities with high health disparities and inequities. And the state chose 5 of them in 2012, one in Baltimore City, one in Prince George's, one in St. Mary's, one in Annapolis, and one in Eastern Shore, and got tremendously good health outcome results and reduced hospitalizations and uncompensated care. It was really working, but it was a 5-year pilot. Unfortunately, in 2016, it was not renewed. I think part of that was just political. Governor Hogan did not want to renew something that the O'Malley Brown administration created, even though it was working. So it was is not renewed. But under this legislation, we would renew this program and build it make it permanent, and we hope with a permanent funding mechanism. Now, we had originally proposed the measure to have the funding by a one penny per dollar increase in the state alcohol tax, which would have continued to reduce underage drinking and drunk driving, like our 2011 alcohol tax increase, but would have provided long-term permanent funding for this program. The legislature was not ready to do that this year. But what they did was provide $14 million now to the Maryland Health Community Health Resources Commission to address health disparities, and by 2022 or 2023, set up the health equity resource communities, and we'd have to come back in 2023 to find a permanent funding mechanism, which we frankly think should be the 1 penny per dollar increase in the state alcohol tax. So the way the health equity resource communities would work is that local leaders, local health leaders, whether it's a federally qualified community health center or a local health department or a hospital, would bring a coalition together and put together a plan on how to address disparities in their community, present that plan to the state, and a certain number of them would be approved. A couple of the examples from 2012 are really great. In Annapolis, the community group put together a public health center in a low-income housing complex, the Morris Blum Housing Complex, which has worked beautifully to address needs of people, health needs, before they had to go to the hospital. In St. Mary's County, where transportation was a problem, they had a mobile health clinic. Every one of these 5 that called Health Equity Health Enterprise Zones really developed their own plan to address health disparities. And that's what's going to happen under health equity resource communities. As everyone knows, although we've made tremendous progress in Maryland and in this country under the Affordable Care Act, there are still terrible, unjustifiable health disparities. There are some communities in my own city of Baltimore City, with a few miles apart, and the difference in the life expectancy is like 20 years between a predominantly African American and predominantly Caucasian area. And a lot of that problem is lack of adequate health care. So these health equity resource communities would direct resources and help to those areas, and we believe will reduce health disparities and improve health outcomes. So in short, thanks to your great support over the last 20 years, Maryland has made tremendous progress in healthcare for people, and we're going to do more of that this year. And I always look forward to working with all of you. I can answer a couple questions, CC, before I got to go, or I could try to come back.
You got to go, so we'll take questions if we have any questions. I don't see any in the chat room so far. Anybody have any quick questions for Vinny before he has to go? He's doing some important work here. Okay. Beautifully done. You got a lot of information in a short period of time. Thank you so much and good luck with these bills, boy.
Thank you, and congrats to your organization on all your great work.
Thank you. Thank you. Okay, so our second speaker is going to be Ms. Laura Wheeldryer, again, talking about COVID effects on the family unit.
Good morning, everybody. Thank you so much for having me. I'm very excited to talk with you. I have to echo Vinny's comments that it's been a very weird session to do it all virtually, but somehow it's happening. I know none of us could have anticipated it, but look at us navigating a big Zoom of almost 60 people. So I guess, you know, we adapt. Again, I'm the executive director of Maryland Family Network, and I am relatively new there. I've been there about 18 months. I took over from the longtime executive director and founder, Margaret Williams. So I don't have a long history with your organization, but I don't have a long history with really anybody in this job, but I'm looking forward to having one in the future. So we are a statewide nonprofit, and we do several things, and really it's those things that we do that kind of give me the credibility and the information to talk to you today. We run several networks of direct service. We are the largest early Head Start grantee in the state of Maryland. We run a statewide network of family support centers, which are 2-generation programs, meaning they're outcomes for young children and also for their parents who are taking education classes, sometimes English language classes, job training, parenting skills, etc. And we run the statewide network of childcare resource centers. But probably the work that most informs what I'm going to talk to you about today is our policy work in Annapolis. And when we do that work, we try to present ourselves as the expert voice on behalf of 3 constituent groups: babies and young children, their families, because you don't get babies and young children without their families as well, and their caregivers. And those are the 3 groups I would like to talk to you about today. I'm going to spend a couple of minutes on context, and then I'm going to talk about how each of those groups is doing. Not exhaustively, but from our perspective at Maryland Family Network. So in terms of context, I guess I want to say this country is not a family-friendly country, and that was true before the pandemic. Certainly a lot of issues and gaps in our social safety nets have been highlighted in the last 12 months, but UNICEF, which I don't think is really a controversial organization, has a framework on which they rate countries in terms of their family-friendly policies. And we don't have any of the policies in this country that they consider to make family-friendly countries. So that is kind of shocking, I think, when you think that we are the richest country in the world, but we actually do the least in terms of the policies to support families and young children. We spend less on early childhood education than almost every other developed country. Only Turkey, Latvia, and Croatia spend less than us. But the truth is, a lot of people just say, like, well, that's this country and that's the way it is, but that's not accurate. We have a history of really investing in early childhood care and education. If you just look back far enough, and it's not even that far, it's World War II, when the country recognized that women needed to join the workforce because men were in the military, and the federal government invested in a network of childcare to the tune of $1 billion, and that's been adjusted for today's economy. And we served several hundreds of thousands of families in every state in center-based childcare. And parents paid what equates to about $10 a day. In today's money, it was 50 to 75 cents back then. So there is a historical and cultural precedent. And not to mention that Washington, D.C. has universal preschool right now that is working just, 45, 47 miles down the road from us. 90% of 4-year-olds in D.C. attend a full-day preschool program for free. And 70% of 3-year-olds are in the same program. And this program has increased the maternal workforce participation in Washington, D.C. by more than 10%. So all I want to say is that even before COVID-19, the lack of affordable and high quality childcare was a crisis for American families. And then, of course, the last 12 months hit, which has made it a crisis on a number of fronts. In 35 states, families pay more for childcare than they pay for their mortgage. And the federal government defines what is affordable childcare, and there's not a single state in the country where the average cost of care meets the federal government's definition of what constitutes affordable. So if you combine that to the fact that on a per capita basis, we spend 6 times less on early childhood education than we do on K-12 education, I think you're going to see that we're shortchanging our children and our families at the moment in their lives when the impact of intervention and high quality care actually is the most meaningful and has the best long-term outcomes and return on investment. Okay, so that's the context. It's not a cheerful context, but I think it's helpful to know when you think about what has been happening over the last year. So for families, and I don't think any of this is things that you don't see in your own extended family, read about in the papers, see in your neighborhoods and communities, but basically, traditionally and historically, women are the shock absorbers of our system. So when there is a shock, it's women who bear that burden. And the more precarious you are within the system, the poorer you are, whether you speak other languages, are not white and middle class, the more shock you are expected to absorb in our system. So what does that mean? And what am I trying to say? I mean, first of all, industries that are dominated by women employees have been decimated. So you think about like restaurants, retail establishments, hospitality, healthcare. So many people have lost their jobs or have been expected to stay working because they're not jobs that can be done from home. So there's both unemployment and there's the demand that people act as essential personnel, even though they may be very low on the wage scale. So in past recessions, the recession hit many industries equally, which included male-dominated industries. But that hasn't been true in the last year for obvious reasons. Manufacturing and construction have not been hit as hard as some of these female-dominated industries. So also at the same time, because of very legitimate health and safety concerns, childcare in a lot of states was told that you must close. In Maryland, unless you were approved to provide essential personnel childcare last spring, childcare was shut down for 3 months. So again, this is the shock absorption role that women play. Survey after survey has shown that it's women who either took time out of work to basically be principal, 4th grade math teacher, recess playmate, guidance counselor, lunch lady. It was more women than men who either took time out of work or just took time away and were, I know at MFN, I have women who are parenting during the day on my staff and working, late at night. I mean, we're asking people to do impossible things because they're balancing many full-time demands. We have seen a huge stream of women leaving the workforce in the last year. Economists are still catching up with the impact of how this is going to play out over the long term. But I think there was some really startling statistic in September where there was quite a bit of job creation. Remember back in September when things seemed like they were, going to be okay again before we got into second and third waves and the weather was nice. And anyway, I remember it. It was a highlight of the last year. In September, the number of women leaving the job force like tripled the number of jobs that were created in September, just as kind of a shocking comparison of data points there. So as coronavirus shut down schools and childcare centers around the country, keeping kids at home and making it even harder for parents to keep working, we faced kind of this conflation of crises for parents, children, and childcare workers. I will just say a couple more things about how women and families are faring specifically. Women, working women are at a disadvantage because when compared with men, they have jobs that do not allow them to telecommute. 22% of women compared with 28% of men can telecommute. And probably no surprise to any of you, single parents, of course, face a tremendous challenge during this time as well, balancing the demands of parenting, working, and a lack of childcare or school. So now let's talk about how kids are faring. So there are a lot of unknowns, but the data that we do have is not great. There was huge, unprecedented numbers of young children missing their well child visits and their scheduled vaccinations. There have been individual efforts to correct that, and doctors' offices and clinics trying to do really creative things to get families in, things like offering incentives, offering transportation, especially for families who may, for example, get there. This kind of dovetails with what Vinny was talking about, where there's not easy access to high quality medical care. You might have to go to a clinic where you can't make an appointment, and you might have to ride public transportation. There's obstacle after obstacle after obstacle when there are truly legitimate and scary health and safety concerns. So when children are not in childcare and are not being seen by their pediatricians, there's some rolling implications of that. There are fewer adults observing those children and potentially saying like, something is not right here. So for example, referrals to infants and toddlers are way down because fewer people are seeing young children and being able to assess whether they're meeting their developmental milestones. Unfortunately, this has safety issues as well. If children are not being seen by teachers, by doctors, by caregivers, or even by neighbors, there may be unacknowledged safety, abuse, and neglect issues. So referrals to child protective services are also precipitously down. To be honest with you, no one knows the long-term developmental impact on young children. So one thing we know is that kids are amazingly resilient, and that's a wonderful thing. But honestly, and I say this as somebody who has done it myself, we've moved all of our early Head Start supports and programming and services online, virtual, just like you have, and same with our family support centers. But there is no research that says whether that is effective for babies and toddlers, whether they can get the same kind of social emotional development support or learning over Zoom or over FaceTime. So, everybody has pivoted, has worked amazingly hard, has employed creativity and innovation, but truly, we're kind of shooting in the dark here. We do not know if this is an effective way to interact with young children over the long term. So the last thing I'll say is that one of the big ways that young children learn, and you all probably know this through personal experience, is they learn through exploring their world. And in the last year, many young children's worlds have gotten very, very small. Lots of cities and towns even closed their playgrounds and their parks at the height of this pandemic. So a lot of children have missed out on the opportunity to explore their world freely, to be outside, to spend time with multiple adults like extended family and caregivers, and even to interact with other children. They have not had what we would consider to be ideal, developmentally appropriate opportunities to explore, to inquire, to touch, to smell, to feel the things that provide sensory input and stimulate their developing brains. So this is a critical piece of the unknowns of what we will bear as a society as the result of the last year, what it will do to school readiness, to social emotional development, and to things we really care about, because we know that 85 to 90% of brain development happens by the age of 5. So we're missing critical times right now. So a big way that young children learn and explore the world is in childcare settings, whether that is, their grandmother's house, somebody who's taking care of them in their family, or a childcare center, a family childcare provider, Head Start or Early Head Start. These are structured care and learning opportunities that many children in this country take advantage of and do some wonderful things for children. But childcare has also suffered, and that's what I'm going to spend the rest of my time talking about, because it's kind of the bridge between kind of reopening our world and families and children getting what they need. So childcare providers, who are, by the way, mostly women, almost universally women, and quite frequently majority women of color, they earn a ridiculously small amount of money, which really matters when you're shutting down businesses for periods of time, right? They make on average $12 an hour. Childcare operates on a razor-thin margin in the best of times, and people who work in childcare have limited to no health insurance. So last spring, childcare workers and childcare providers faced a difficult decision of staying open, like applying to be an essential personnel childcare provider, or closing, weighing their own health risks and limited benefits against the needs of families and their revenue. So one of the things Maryland Family Network has done, there was a national survey last spring that showed very dire predictions for childcare. And after that, many states were like, oh, we better do a state survey. I don't want to trust a national survey. Maybe our results will look much better. They didn't. They really didn't. They all looked pretty much like the national survey, which predicted that 50% of childcare providers might not survive the pandemic and might close permanently. And that would be catastrophic for our economy and reopening businesses, schools, et cetera, and getting people back to work. It would also be catastrophic for families and children, because there are already huge swaths of Maryland that don't have access to enough high quality childcare options. And so this would just further exacerbate that divide. So we did a survey last spring, and we just repeated the survey really in time for the General Assembly session, because I think that maybe the legislature had thought like, oh, childcare is reopened, like the crisis is past for them, we're good. And we wanted to make sure to remind them that that is not true. And I'm just going to share a few things from that survey with you. Understandably, a lot of parents have struggled with the decision to send their children back. We've done some parent surveys. They're not perfect by any stretch of the imagination, but we hear from parents fear about COVID is a huge factor in not sending kids back to care. Also, their school-age kids have been home. So why should I be dealing with my school-age kids during the day and paying somebody else to deal with my younger kids? Our fear is that a lot of older siblings have de facto become the child care providers for younger kids. But also some people have lost their jobs, or jobs have gotten difficult in terms of schedule. That also affects children going to childcare. So in January of 2020, we knew that childcare programs were at about 80% of their capacity in terms of enrollment. On average, obviously, I'm giving kind of high level stats here. In May of 2020, they were at 40% of their enrollment capacity. And today, there's been a little progress, or at the end of January, beginning of February, when we did the survey, we were at 53% of enrollment capacity. So even though on paper, childcare should be back to normal, that's just simply not true. They're terribly, dramatically under-enrolled. And even if everybody wanted to come back to childcare, it's not possible with social distancing requirements and some other health and safety requirements about best practices to keep kids and the adults who care for them safe, they really couldn't accommodate it, even if there was suddenly a flood of parents wanting to come back in. So on the one hand, you've got decreased enrollment, which means lower revenue. And on the other hand, you've got higher expenses. So it's like a double whammy. The higher expenses are because the need to buy PPE, the need to buy Lysol and bleach, and I will wind up, sorry, I promise I'm almost at the end. The need to have people to take temperatures and greet parents in the parking lot or at the door so that other adults aren't coming into the building. So our survey showed that childcare providers have seen an increase of an average of $5,300 per month per location in the last year. And 79% of providers say they've experienced a financial loss in the last year. And still holding steady from last spring, 49% childcare providers say they may close for good if help doesn't arrive soon. So my last comment, I saw somebody asked in the chat about all that COVID relief and stimulus money coming from Congress. So I'll take that question, Cece. There is a little bit of good news. It's coming pretty late. Other states have done a lot more in the last 12 months for childcare than Maryland has. And I'm happy if somebody is interested to talk more in detail about what Maryland has done. But remember the stimulus relief that was passed by Congress in December? That money, there was a chunk of it specifically for childcare. Maryland got $130 million from that December congressional bill. And 60 million has been put into grants, like direct relief grants to childcare providers. That process has just wound up. I actually had hoped to get an answer from the state about how many providers applied and how many dollars got spent. So next time I talk to you, I can let you know. We know that now in this recent Biden administration, huge stimulus bill that's been passed, Maryland stands to get, and it's kind of mind-boggling, but just for childcare, $502 million coming to Maryland. What it will be spent on is unknown right now, but certainly some of it will go into a direct grants program to childcare providers. And the bottom line is that on all of the things I just said, national advocates and state advocates like MFN are saying it's time to re-envision this system. The COVID pandemic showed all of the ways the system is inequitable and broken and full of, potholes that are terrible for our young children and parenting families, and we have to do something better. I'm happy to answer questions. Thank you.
It's a lot of information, and I apologize that we have such a short period of time, but I tried to make as many notes as I can and report. We may as well does anybody have a hot question for Laura before we move on to our last speaker? I think we got a couple of these questions answered. You took care of those, and I thank you so very much. So our final speaker, what?
I said
Our final speaker is Lauren Shavitz, the Executive Director of HANA. Pardon me. She's going to be discussing abuse issues during COVID. So thank you, Laura, and Lauren will now take over.
Well, thank you. Thank you all for having me. I'm really happy with the order in which you put us, because I'm so happy to have been able to listen to everything that that Laura had to say, because she's really done some of my work for me. Because the things that she has described, I want you to just take a moment and picture all of the things that Laura has described about working mothers, working at home while they're also trying to be a teacher, lunch care provider, a playmate for recess, all of these things when there's abuse going on in their home at the same time. And so I really invite you to take everything that Laura just said, and now let's add on to that the mother may actually be a victim of abuse. I'm so happy to be with you all today. I want to thank you for your ongoing commitment to HANA and our mission. The Federation has always been so incredibly generous to us and to our clients. We were so thrilled to receive gift cards from you all that we were able to give to our clients to help them with their basic needs this year. And I'm really appreciative for you including me and our organization in this conversation today, because we too are seeing things that we have never seen. I've been in this field for 25 years, and I can tell you that I've just never seen things like we've been seeing over this COVID pandemic. HANA, I'll tell you just a moment that HANA is in its 26th year. HANA is a program of the Associated Jewish Federation of Baltimore. And we are an agency that has expanded over the years. We started as a small agency dealing with the issues of domestic violence. And then over the years have taken on other issues of abuse that we recognize in our community. So we also work with childhood survivors of sexual abuse as well as elder abuse. And one of the things that we've learned in our 26 years that wasn't known 26 years ago is that our Jewish community experiences abuse at the same rates as every other community. And one of the interesting things is that to think about is that we've all seen the headlines from around the world during this time of the spike in abuse across the globe throughout the pandemic. And we too are seeing that, unfortunately, in our very own community. And I'm going to give you some numbers just to give you some context to what we mean by the fact that we're seeing an uptick in abuse. We're really seeing this as a crisis within a crisis. We have our COVID-19 pandemic crisis, and then we have the crisis of an uptick in abuse. Over the last year, we have seen a 75% increase in the amount of calls that we receive for help. We've seen a 138% increase in the duration of those calls, meaning not only are we receiving many more calls, but the amount of time we're spending on each of those calls has increased drastically because the level of danger that people are experiencing has drastically increased. And we have had an increase of 153% in shelter nights that we have provided throughout the pandemic. So people will ask why. Why is this an issue? Why are we seeing such large spikes? And I think some of the reasons are really obvious. Isolation, quarantining, the proximity of a victim and their abuser without the ability to reduce tensions, without the ability to go to work, to leave the home, and really being trapped in the home with one another certainly accounts for some of this. There's also some indicators that we look at whenever we are looking at lethality, how dangerous the situation might be. And those indicators themselves have changed throughout the pandemic. And what I mean by that are unemployment is directly related and directly correlates with abuse. So as we see increases in unemployment throughout this time, it directly relates to an increase in abuse. Similarly, as an increase in alcohol sales. The alcohol industry, the liquor industry is one of those businesses that has flourished throughout the COVID-19 pandemic, and alcohol sales are up about 250%. And with that increase comes an increase in abuse. We've also seen a whole new category of abuse develop. We've always thought about abuse in terms of sexual abuse, physical abuse, psychological abuse, financial abuse, spiritual abuse. But now we almost see pandemic abuse. We see abusers using the pandemic as a new way to abuse, spitting on their victims, inviting people into their homes and not abiding by social distancing guidelines, going out and not wearing a mask intentionally or not social distancing so that they can intimidate their victims when they come home, that they're bringing the virus home. And all of these factors have really led to a spike and led to an increase in the reports. And what we expect to see is that as the pandemic comes to an end, we expect to see these numbers continue to rise because we know that not everyone is coming forward at this time. We know that a lot of our clients are in a position of determining whether they're more scared of the virus or they're more scared of their abuser. And I will tell you that within the first month of the pandemic, we received a call from someone stating just that. She called and she said, I don't know whether I'm more scared of the virus or of my abuser, but she said that her biggest fear was that her abuser would kill her and nobody would know because we were all in lockdown. And we've seen these kind of statements made to us over the past year where people are really in a position of deciding what they're more afraid of, their abuser and staying in this situation, or whether they're more afraid to leave the situation and expose themselves to the virus. But one of the things that I think is really important to note, and it's very, very similar to what Laura was saying with respect to children, is our work with elder abuse. And when we talk about elder abuse, we have two categories by what we mean elder abuse. We have older adults who are being abused by their intimate partner and may have been abused by their intimate partner for 40, 50, 60 years. But we also have a category of abuse of older adults who are abused by their children and their grandchildren, unfortunately. And we know, and I'm about to share some really, really difficult statistics. We know that 42% of people over the age of 60 who are murdered by their children or grandchildren. And we know that 24% of people over the age of 60 who are murdered by their spouses, their intimate partners. Unfortunately, like Laura said she was seeing with children, is we are actually seeing a major decrease in the calls that we receive about elder abuse for similar reasons that I think that we're seeing a decrease in calls about child abuse. First, we know that older adults are not leaving their homes. This is the most vulnerable population to the virus. And so this is the group of individuals which have had to quarantine the most seriously. And so they're not out in the community for people to identify things, to pick up warning signs and red flags that something's going wrong. They're not going to senior centers. They might not be going to their bank tellers. They're just not out in the community in the same way for people to identify things and express concern. The other way is that older adults are more reliant than ever on their caregivers and their families in order to get them food, get them medications, help connect them with technology, perhaps if they don't know how or they didn't have the technology, in order to have telehealth appointments with their doctors. And so when there's more reliance and more dependency on our caregivers, it makes it that much more difficult to think about stepping up and reporting if these same people are abusing you. And so Adult Protective Services throughout the state of Maryland throughout the pandemic has reported a 57% reduction in calls. 57%. And I'm certain that's not because older adults aren't being abused. And so we too have seen a drastic reduction in these calls. And so what we expect and what we hope is that after the pandemic ends and we can all be back in the community and older adults can start going to senior centers again and going back to their banks and going back to the grocery stores and feeling safe doing so, they will also feel that they can reach out for help. What has also happened during this time for us is as danger has increased and as the numbers have escalated and the spikes in violence have escalated, the resources available to really deal with these issues have decreased and become much, much more complex to navigate. So I'll give you a few examples of what I mean by that. Courts. The courts are changing in and out of phases almost on a weekly basis about how they handle situations. At the very beginning of the pandemic, it was changing almost on a daily basis how someone could obtain a protective order and try to get away from an abuser. It was always available. It was never such that someone couldn't get a protective order, but it was changing every day. And it was very complicated. And it wasn't working in a way that really made it easy for victims to be able to obtain protective orders to get to safety and get abusers out of their homes. It was really creating another barrier for victims to be able to do this. And also with the courts is that the courts shut down for several months. The courts weren't open. And what happened when the courts weren't open is that it's created a backlog of cases. And so a lot of our clients are waiting for child support cases or divorce cases in which they hope to get financial stability through these cases. And they're just waiting They're waiting and waiting and waiting, and they can't get in, and they can't get court orders to give them the financial support that they need in order to survive. We've also seen similar things with the jails. The jails throughout the pandemic have been releasing people sooner in order to decrowd the jails and to not have a COVID outbreak within the jails. And so a lot of our clients who thought that they had safety because their abusers were serving time in jail, suddenly, without notification, because the systems were overwhelmed and unable to notify them in the ways that they should, suddenly have abusers banging on their doors, demanding to come into their homes that they think that they and their children are safe because their abusers are in jail. Just another way that the pandemic is affecting us on a daily basis. Similarly, there's issues of housing. Oftentimes, when victims want to leave a relationship, the first place that they'll think about going is to a family member's house or a friend's home. Well, that has completely become unavailable throughout the pandemic. It's not safe for people to go to their friends and families' homes, and friends and families don't feel comfortable taking them in at this time. And victims don't feel comfortable imposing upon them. And so we've lost the first step. Now we look to hotels. A lot of hotels in Baltimore City particularly have either closed or become quarantine stations where people are spending time who may be at risk for COVID. And so we've lost a lot of resources as far as hotels. And the hotels that are open, a lot of them have stopped with food service. And so if we send someone to a hotel, it becomes very difficult to think about how are we going to get food to them. And then if we add in the layer, if we have someone who keeps kosher, who needs kosher food delivered to them, it's even become that much more difficult to think about how we're going to make this happen. One of the other ways that our clients have been impacted is through government shutdowns. There was a time where most of the government agencies had closed down. So we had several clients who fled from domestic violence. We had one client who was abused so horribly that she woke up on the floor, beaten severely, and called 911. She was taken to the hospital. And when she awakes at the hospital, she has nothing. She doesn't have her license. She doesn't have her ID. She didn't have her immigration papers. She has nothing. Well, how do you get these when you can't go back into the home because it's not safe to go back into the home, but the agencies are closed and you can't get a new birth certificate right now and you can't get a driver's license? And how do we find you housing when you don't even have any idea as to who you are? So you can see the trickle-down effect of all of the government agencies closing and the impact that that had on our victims and the barriers that it really created for victims who were already in a very unsafe predicament. And kind of like Laura was saying, this is already a system that's very, very difficult for victims to navigate. And it's really why Hannah is here to help victims. It's a difficult process to navigate when there is no pandemic. But then you add in all of these barriers and it just makes it that much more complex. So what are we doing at Hannah? At Hannah, we have been working from home since day one. Some of our staff, just like Laura said, have their children. I fortunately have a teenage child here, so it's a bit easier for me, but I certainly have staff. Our deputy director has a 4-year-old at home with her. Difficult, really difficult to try to be on the phone with a victim of abuse while you have a 4-year-old standing next to you saying, mommy, 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 mommy. Really challenging. But we are home, we are taking our calls from home, and I have to say, our operations have been seamless. We have just kept going in this new route. And I will think part and parcel that is because we are a crisis intervention agency. We are used to being in a crisis situation, having to pivot quickly. It's the work we do every day. And so we were kind of designed to be able to pivot quickly and figure out how to operate from day one in this way. We have continued with our groups. Our groups have just moved to a Zoom platform. We can't run all of our groups because for victims who are currently in a dangerous situation, how will they do that safely in their homes? So some of our groups, it's not safe to do, but the groups that we found are safe, and we've changed the focus of some of our groups so that our clients can still have contact. So our groups will focus more on self-care rather than talking about abuse per se, but so that people can still have contact. One of the things that we're most proud of at HANA is that we've been working for several years to come up with a digital response. And what's interesting is that we were looking for a way for youth to be able to connect to us through technology, because we know that young adults do not pick up the phone and call. They like to type their feelings. And so we were looking to launch a chat line out of our website where you could have a chat, just like if you were shopping in a store and it says, would you like to chat with someone live right now? And we were looking to do this last summer. But we rolled that out a little bit sooner, and we offered it and we put it out April 1st so that people could stop calling us behind the bathroom door and stop whispering and saying, I have 30 seconds to talk while he's in the bathroom, or he's out walking the dog now. I have 1 minute to talk, where they might be able to sneak a chat to us. And one of the really interesting and positive things that is coming out of COVID-19 is that we've seen that older adults do great with technology in a way that perhaps nobody realized. You know, I didn't know how to use Zoom a year ago, and I'm sure that most of you didn't either. I didn't even know what the word Zoom meant. And now look at us. We're all here and we're all using technology and we're all able to do this. And so what we are going to do moving forward is really teach older adults how they can chat us in the future. When we initiated this was just thinking about younger adults. But now we're really going to market this to everyone, because we all know that we now can access technology in a way that perhaps we didn't know that we could prior to the pandemic. And so we see that as one of the benefits. We have continued our work in the schools to do prevention work. We are joining with other agencies to try to do prevention outreach to all ages, from youth to older adults, and remind people to look out for their friends, to look out for their neighbors, and to look out for themselves. And then HANA is still here as a resource and will continue to be. And so one last thing that I will leave you with is really just, again, gratitude. We have been so lucky in our Baltimore Jewish community to have the support that we've had. We have not had to turn one client away. We have not had to tell one client that we couldn't shelter them, because we have such generosity from our community. And a lot of that I know comes from you all as a group and from you all individually. And so I really, truly need to thank you on behalf of our staff and our clients and our board for everything that you do to help us be able to help our community at these really, really difficult, trying times. And again, thank you so much for including me in this talk and having the opportunity to share with you all. I'm happy to take any questions if you have any.
And thank you, Lauren. A couple comments is that we're so lucky to have the Federation, and all this information is so important, and it is heart-wrenching. And then one person said they were surprised to understand that liquor stores were considered as essential food stores from the beginning of the pandemic. Then as far as Laura, wheel driver, what can the Federation do to support the great needs of children and families in Maryland to improve services?
I mean, I think there will be plenty of advocacy opportunities, and it sounds like you have already a well-oiled machine for legislative advocacy. That's the first thing that comes to mind, because I truly think it is going to be really re-envisioning and redeveloping the system of childcare. I wish there was another easy answer of things that you could do. I guess I would just say check in on people that you know with young kids, especially if you've been vaccinated and you're feeling more confident about interacting with people. I mean, I feel like there's some signs of hope, or maybe I'm just hoping there's some signs of hopefulness. That and warm weather could be a game changer for us right now.
Right. And for Laura, and Hannah, I know that we're doing gift cards, but can you let us know, or if you want to email me offline as to what we could possibly do, like clothing or supplies for the women that come to Hannah?
Sure. It's amazing the things that we've seen people in need throughout this time. We have a client who recently fled an abusive relationship that she had been in for 50 years. And one of the things that was hardest for her is that when she fled, she didn't get to take any of her Judaica with her. And so the things that really can keep people in an abusive relationship sometimes would surprise you. It was incredibly, incredibly difficult for her to leave behind her father, who had passed years ago, to leave behind his prayer book.
Yes.
And her husband is not allowing her to have that. And so there's a whole list of things that I'd be happy to provide you with. Judaica is one example of ways that we can really provide meaning and help and security to our clients. So I would be happy to. Thank you.
Thank you. Okay, well, I think unfortunately we need to wrap up. I know, Helene, you've got a question about particular legislation, but I think there's several pieces. I'm not sure exactly who you wanted to direct that to.
Well, I know that we're watching several pieces because we work with MLaw on the women's issues, basically. But I'm sure there's some children's issues that we need to begin to look at that we really haven't done. So is there anything that's pressing right now that we should try and send notices to?
I'm happy to send you a few things in a list as a follow-up. There are a few bills related specifically to childcare, and there's also, I think you're probably doing this already through MLaw, but there's paid family and medical leave.
Right, we're very much right. That we're doing, but it's the other pieces of.
I'm happy to send you a list.
Yeah,
Okay, that would be great. If you'll send it to CC, she'll disseminate it. Okay,
I
CC.
sure will.
Perfect.
Great.
I'd be happy to send some as well. Our main priority legislation, while there is a lot of legislation around elder abuse, and there is some domestic violence legislation, the most important thing to us right now is about funding, because we are under some serious threats of funding cuts from the government, and we rely tremendously upon that. And so these bills to really save our funding are crucial for us to be able to do the work, to focus on the other bills to actually make the impact we need to make. So I'd
Right.
be happy to send
Will
it.
you send those as well, so that, because I'm not sure we're dealing with funding, we are dealing with the spousal issue and the feminine hygiene and whatever, so that would be great to know about the funding also.
Absolutely, thank you.
Well,
Is there, I mean, do people volunteer within your organization, let's say, and I don't know what the legalities of this, so it might not be something that could happen, that could make phone calls to, like, say hello, how are you doing, or things? Is there like something set up like that?
So it's a really, really great question. So there's two sides to that question. First, we never reach out to clients initially. We always wait for them to contact us because of the danger. If we were to call someone, not knowing what their circumstance is at that moment, we could actually create a tremendous amount of harm. So we always, unless we have a set time to call someone or a particular reason, we don't reach out to clients because it can create more harm than good.
Right.
And then the other part of that about volunteering is when Hannah was started, we started with a helpline that was completely staffed by volunteers. And the issue with that now, we have people all the time who want to volunteer. And the problem with that is that our mission has expanded so much. So we're doing so much, but really more difficult than that is technology. Technology can be used to abuse, and is in almost every case that we talk to, there's some sort of form of technological abuse. And it is hard for our staff to remain current about technology abuse, because while we've been sitting here talking, there's probably been 200 apps that are created for good, but can be used in a way to abuse someone. And so I could have a full-time person just trying to keep, abreast of what's happening. So it's very hard for us to stay informed. It would be virtually impossible for me to keep a network of volunteers informed with best practices
Right.
because things just evolve so quickly.
Okay, thank you.
Thank you.
Lauren, Laura, and Vinny. I think Vinny had to leave, but I just wanted to thank you again. Again, this is information that is so important, and yet heart-wrenching, and yet real. So we as a federation are interested in all of these aspects. And as Helene said, if we get that information, we'll be disseminating it and see what we can do for our part as the federation to assist with families, children, elders, and during this pandemic. So thank you again. Thank you everyone for being here. And until the next time.